Alright guys, it's jerningham here. Most recorded corona deaths in the UK. Department of Health says 104 people in the UK have died after testing positive coronavirus, and 643 more people have tested positive for corona. Beginning of the total numbers. Cases in the UK have gone up to 3,269. Virus Domenic says 427 more people have died in Italy, bringing the total numbers of deaths to the country 3,405, meaning Italy has now overtaken as the country with the most recorded deaths, which should be saying, because I've just gone onto an advert and a break there. I was trying to do a video a few minutes ago to update you guys and let people know, but the TV crashed, I think. I'm sorry if my words sound a bit annoyed and a bit angry, I've got a bit of a hangover because I did it a bit hard the other day with the drinking. I'm trying to update you guys with the videos and what's going on with the coronavirus. We all know anyway, but it's getting worse. I mean, apparently the army may be going on the streets in London, probably around England as well, and Scotland and Wales and Northern Ireland probably, eventually, to keep law and order, I would presume, but who knows. You know, and in my lifetime, guys, I never would have thought I'd be living through this sort of scenario. Some people would say it's a World War III, but who knows? I mean, there's World War One and Two. Some people probably don't like talking about war. Other people probably do. I mean, no, I don't think nobody enjoys war, but it sort of has that kind of feel. It could be like a bit like war, if that makes any sense. The way things are going, if they're bringing out the military on the streets for a couple of weeks to make sure people don't catch the spread of coronavirus, could it get worse? Could it mean for the people that it's more than a couple of months? I mean, the schools are closing in the UK, they're closing in Ireland and Scotland and Wales, and you know, how worse is it going to get before it gets better? And then you get Boris Johnson saying he can turn it around in 12 weeks' time, apparently, until the summer, which don't think that's true though, but as I say, we shall see what it becomes and the outcomes become with this coronavirus. It's not nice. We've lost like more people today as well. What could one say, guys? I mean, I went into the shop today in real life, and the shops were barely full of stuff. Usually when you walk into a shop, you're supposed to see it full with stuff. People have been over panicking and buying lots of things and supplies, especially the old people. If they can't get out, are they going to stockpile for the old people? Are they going to? Is that why all the shops are empty? So if the old people can't get out, then they got stuff in. Is that why it's overcrowded and why the shops are barely full with food and stuff? The food's going down, and everything's going down. It's like living in a war. And some people can probably laugh and think I'm going crazy and don't know what I'm talking about, but you can see the signs. Why would they put the army on the streets? Why would they shut down 40, I'm saying 40, underground tunnels just to slow down the coronavirus? It's craziness. You know, they've shut down Italy, they've shut down other places, they shut down China for a while, didn't they? If China are getting back on their feet, there could be more cases breaking out, I don't know. The world's going crazy, guys, in my opinion. Put it in that way, perspective. Don't know what else to say about this. We are living in strange times, is my opinion. Makes you think and wonder. They really need to get a vaccine for this coronavirus. More people are going to die, as we all know. Each time people die, that's somebody's loved one and someone's family that they're losing over coronavirus, and it's taking their life. I mean, you know, the governments say they care, and I reckon they do care, but they don't know how to get on top of this coronavirus. They need more ventilators and things to help people breathe if they're got cancer, if they've got asthma. I mean, I had asthma. I've got asthma. I've had cancer 2 years ago. I had testicle cancer, which most people probably don't know, and some people probably do. But it's not the point now. We're losing a lot more people, and that each time we lose somebody, that's somebody's family member, somebody's loved one. That's what I'm trying to make you guys realise, and we all know anyway. You know. I'll put the thing back onto the news.
It's 7 o'clock. This is Sky News Tonight with me, Jerningham. The top story, the new epicenter of COVID-19. Italy takes over from China as the country with the most deaths, as the number rises above 3,400.
Bloody hell.
The Prime Minister says the UK can turn the tide against coronavirus within 12 weeks. Money for almost nothing, the Bank of England.
I don't think they're going to be able to turn the coronavirus in 12 weeks. That's just ridiculous.
We'll have more on the warnings of a sharp and large shock to the UK economy. Also tonight, schools out, parents face up to possibly months of childcare. Unanswered exam questions, A-level and GCSE students stuck at home seek clarity on what happens next and how to keep on your fit on your own. Mr. Motivator gives Sky News an exercise regime for self-isolation. Very good evening. The coronavirus originated in the Chinese city of Wuhan in December, and today Italy overtook China as the country with the most deaths from COVID-19. Here are tonight's main coronavirus developments. The number of people who've died in Italy has now reached 3,405. The Prime Minister has said the UK can beat coronavirus in the next 12 weeks, but only if we follow the government's advice. The Bank of England has cut its main interest rate to 0.1%.
Some people just think they live in fantasy land. It's not going to just go away like that. Coronavirus.
More than 3,200 people have now tested positive for COVID-19. That's a rise of 643 in the last 24 hours, and the number of people who have died from it is now 144. And the government has published an emergency coronavirus bill, which includes measures to increase the available health and social care workforce, ease the burden on frontline staff, and try to manage the deceased with respect. Well, the number of cases and deaths in Italy has continued to rise despite a nationwide lockdown, which has seen everyday life severely restricted and people told to stay at home. Well, so far, there have been 41,035 cases of the virus there. 3,405 people have died, 427 of them in the last 24 hours. Well, from Rome, Sally Lockwood sent this report.
Italy's military can't protect it from this threat, but the army is now needed to move the growing number of dead. Soldiers called in overnight to take coffins from one of Bergamo's cemeteries. The pressure's so great, a church there has become a temporary morgue. The mayor of one province in the region says hospitals are so overwhelmed, people are dying at home.
It's ridiculous, this virus, guys. I mean, a lot of people are getting annoyed by it, but they seem to be taking so long to this vaccine. They've really got to work up these doctors and scientists.
80% of those infected are doctors and nurses. One of the most sophisticated health systems in Europe, now desperately in need of the basics. Beds, oxygen, ventilators, staff. As citizens look on helplessly, many have rushed to donate blood. After an emergency call for donations, Italians have helped bring supplies back to a safe level.
In Italy, we are trying to build our unity for the first time maybe in our history. Very different because it's the first time that all the population has to stay at home.
And that is going to continue for some time yet. 60 million people confined to their homes in a bid to stop the spread of this virus. The lockdown that was in place until the 3rd of April, now extended.
The crisis has reached an inescapable reality for Italy, that this national lockdown is now in place with no end date. While China recorded no new local infections for the first time since the outbreak began 3 months ago, Italy now has the biggest loss of life globally.
The social and economic toll it's taking on people is clear. The country feels in a state of stress.
Riesci a descrivere?
Il problema grosso è l'economia a quel punto. Più tempo passa, più sarà difficile riprendersi.
As this crisis continues to escalate, comparisons are drawn between fighting the virus and fighting a war. But for many here, it's simply a living hell. Sally Lockwood, Sky News.
Definitely is.
Well, here the Prime Minister pleaded with the public this evening to follow the government's guidance to turn the tide, he said, and try to beat coronavirus within the next 12 weeks. Mr. Johnson said that with a mixture of scientific progress and determined collective action, the UK will succeed and save thousands of lives. He said public transport in London would not be stopped, but warned of extra measures if people did not do more. We'll have more on that in a moment. But first, our political editor, Beth Rigby, reports now on the Prime Minister's slight message of hope.
The heart of London at the height of rush hour, a different looking city, a different looking country, an unprecedented level of executive power now required to cope with coronavirus. Emergency laws, 321 pages of them published today, from helping the public by widening access to sick pay and changing rules for hospitals and schools, to helping the government keep a handle on the crisis, new powers to detain infectious people, ban gatherings, even suspend ports. The pace and scale of change extraordinary and bewildering. The Prime Minister today trying to give an anxious nation some hope, with a hint of an exit date.
I do think, looking at it all, that we can turn the tide within the next 12 weeks.
There's no way you can turn the tide in 12 weeks.
I'm confident that we can send a coronavirus packing.
And hopes of a vaccine.
Today, we've put the first British corona patient into a randomised trial for drugs that may treat the disease. UK experts, scientists expect to start trials for the first vaccine within a month.
A bit of hope there. You're suggesting to the public that if they follow the rules, that you can turn the tide on this disease. Are you telling people that by the summer, they just might be able to go back to normal life, be able to go on their summer holidays?
I'm very confident that we'll get this thing done. I'm very confident that we'll beat coronavirus. I think we can turn the tide within the next 12 weeks, but it depends on collective, resolute action.
But a rare admission from the Prime Minister, not everyone is doing their bit, as he keeps in reserve stricter measures to force them.
Some evidence that in some parts of the capital it's very patchy, and some areas where people aren't perhaps following it in quite the way that we need them to do.
The Queen leading by example, leaving London with Prince Philip tonight to begin their home isolation at Windsor Castle, promising that she and her family stand ready to play their part in this national effort as she asks her people to play theirs. Beth Rigby, Sky News, Westminster.
Beth is here with me now. So a glimmer of optimism, no more than that. But what makes the Prime Minister think that they can get on top of this within 12 weeks?
Well, he said at the press conference that he felt they could get on top of it in the next 12 weeks, but then he later on also said that he couldn't guarantee it. And when I asked about the summer holidays, there wasn't really a guarantee. And then later someone else asked as well, and he said quite explicitly, I can't guarantee that this is under control by the end of June, because the truth is they simply don't know. I think what he was trying to do in that press conference is, when he asks us all to make these sorts of sacrifices, it's difficult for everyone to do it. And he was trying to give everyone, I think, a timeline of if we can get a handle on it in 12 weeks' time, life might get back to normal. But of course, if he can't get a handle on it and the virus is not in control, then the measures might have to continue. So I think it was more, if you like, a bit of a rallying call, a bit of a sliver of hope for people. But again, there was a clear message about social distancing, staying away from pubs, etc. In Italy, in France, in Spain, people are being told not to leave their homes. They are not allowed to leave their homes unless they're going for food or medicine. And the question has to be that if this disease really is rampaging through the capital, when will they implement more measures? You've heard the scientists all along. It's all about their curves and their modelling and their timing. But ultimately, they need the beds in the critical care wards not to be overwhelmed. So I would not be at all surprised if we see more measures in the coming days.
And they've got high hopes. We heard again today, didn't we, about this test, not a test to whether you've got coronavirus, but to whether you've had it and have therefore developed antibodies. Now, is that in a way still the previous herd immunity thing? If you find out who's had it, then they can presumably go about their business, particularly health workers.
Well, you can do two things. You can, they can go about their business again, and then you have a better understanding of who is asymptomatic from the disease as well, and you've got a better chance of trying to control and contain it, which is why they say it's a game changer. But you're right, critically, at the moment, it's quite inefficient. Whole families staying at home if a child has a cough or a fever. NHS workers or other key workers that could be at work might have had the disease but don't know. So it's to try and build some efficiency back in to the system. That's a game changer. And of course, Sir Patrick too today, the chief scientific advisor, talking about the possibility of a vaccine, because the truth is, with this disease, it now seems that they can't allow it just to run through the population without it completely overwhelming the NHS and death rates spiking. So they need to try and suppress it for as long as they can. And that means that really we need to try and wait for that vaccine and try and control it in the meantime. And that can mean quite stringent measures for all of us in our lives.
Yeah, for what that means, 12 to 18 months, isn't it, the estimate at this point for the development and distribution of a vaccine. Beth, must end it there for the time being. Thank you very much indeed. Our political editor, Beth Rigby, there. And you can hear more from the Prime Minister, another chance to see that daily update, the news conference from the government here on Sky News at 9:30. Now, yesterday, the Bank of England governor told Sky News he was not done with measures to address the economic effects of the coronavirus outbreak. And today, the bank followed through, cutting interest rates from 0.25% to 0.1%, just above zero, and warning the economic shock could be both sharp and large. Our economics editor, Ed Conway, has more.
Well, yesterday, the Bank of England governor, Andrew Bailey, told me that the Bank of England's not done, and today we learnt what that means. Bank of England interest rates down to the lowest level in history, 0.1%. Now, what does lowest level in history actually mean? Well, here you can see Bank of England interest rates going back to 1694, the foundation of the bank, and never in that entire period have they been as low as they are now, down at 0.1%, the lowest they've been in history. Of course, if you have a mortgage, you'll notice that feeding through a historic moment in terms of interest rates. But really, actually, in a way, this wasn't the biggest story. The biggest story was that he's also pumping £200 billion of cash into the economy through quantitative easing, basically create money and pump it out by buying bonds. And this is a big deal. They did it during the financial crisis. But what you'll see here, we'll look at the staircase of how this money has mounted over time. This is far bigger than we saw there. So the financial crisis, they had a few slugs of quantitative easing. That got us up to about 200 billion. Then they put a bit more money into the economy during the Euro crisis, an extra lot there. And then you had the EU referendum. Remember, after the EU referendum, pumping more cash in. But have a look at this slug that we got today. The very biggest, £200 billion going out into the economy. It shows you how concerned they are about what's going on in the economy. It takes the total quantitative easing, money going out there, to £645. They hope that will make a difference, and the rate cut as well. But did it? Well, currency markets have really been concerned about the pound over the course of the last few days. This shows you the pound versus the dollar, and it has dropped down to the lowest level since 1985. Well, what happened after that bank decision today? Well, you can see the pound against the dollar rose a little bit. Now, that's something the bank will be very reassured by. They were really concerned about this, but then it fell down gradually. So still, investors not necessarily convinced that the government and the Bank of England have done enough. They'll be watching very closely. Rishi Sunak tomorrow going to set out some measures to try and pump cash into employees' pockets. Will it be enough? We will have to see.
Our economics editor Ed Conway there, well after Boris Johnson's decision to shut down schools from Friday. Millions of parents and teachers were waiting to find out the scale of the disruption, and children of key workers as well as vulnerable children have been told to still attend school, but there wasn't any clear clarity from the government on who that would actually apply to. There are, of course, unanswered questions too over how students whose exams have been cancelled will be assessed, particularly those hoping to go to university later this year. Well, Sky's Lisa Holland reports on the exam uncertainty facing students.
16-year-old friends Caitlin and Sinman were already away from their school whilst it's been deep cleaned.
Now it's crashed again, see? I keep having these problems that it keeps crashing all the time.
GCSE students know it's their previous schoolwork which they're now likely to be judged on.
Personally, for me, my predicted grades, if that's what they go on, I'm okay. But I know there are so many people that aren't, and it's not fair that they can do so much better in the actual exam. But at the same time, the stress that we've gone through throughout this whole pandemic, it would be so disruptive to have the exams anyway.
Like thousands of others, for these girls, the ritual of revision and exams has disappeared.
I'm quite upset that we're going to miss out on our summer, the Year 11 summer that we've all dreamed of with prom and the Leavers Assembly and all of that. But I'm also happy in a way that we've missed the exams that were meant to be really, really stressful.
This obviously has a massive impact on you, but do you and your friends understand just how serious the coronavirus is?
Definitely, I do understand it, but at the same time, it's so confusing. They haven't put enough information out for us to fully understand it. As us kids, left on social media, that's the only way to get it out.
At every level of education, students' plans are up in the air. Ella Staveley is studying for her A-levels and hoping to go to university.
Obviously, I completely appreciate that this is a global health crisis and everything is being done to save lives and to prevent this virus from spreading, but I think on behalf of both my peers and I, everyone feels a great deal of disappointment.
This year will be like no other in deciding students' results. Scotland has already announced it will give estimated grades based on performance throughout the year. Official announcements for pupils in the rest of the UK haven't yet been made.
Teachers already know a huge amount about their students. There are all sorts of indicators and measures that can be used in terms of the attainment and likely attainment of pupils. And of course, importantly, the examination boards have that expertise, and that includes external moderation.
But there's an understanding too that everyone's education will suffer because of time lost to coronavirus.
We will recognise that this intake will not necessarily have had the same level of support face-to-face that previous years have had. So there'll also be some stuff we'll be doing when students arrive with us to make sure that if any gaps appear in their knowledge, then we can fill them, we can ramp up support.
Like all of us, students will be spending their time in the coming weeks in a very different way to how they imagined. Lisa Holland, Sky News.
And just to remind you that we are currently bringing you hour-long editions of Sky News at 10 with full coverage and analysis of the very latest COVID-19 pandemic news. So join us if you can, obviously from 10. And that extended bulletin will mean we're taking a first look at tomorrow's papers in the press preview. At the later time of 11:30, joining us this evening will be the Director of the Academy of Ideas, Claire Fox, and the contributing editor to Novara Media, Michael Walker. Now, the United States is fast-tracking approval for treatments, including a malaria drug, to prevent COVID-19 or try to reduce its severity. Donald Trump has ordered officials to relax rules to speed up the development of therapies. The president also repeated his criticism of China's handling of the pandemic. Well, our US correspondent Cordelia Lynch joins me now live from Washington. So what more did the president say?
Dermot, well, Donald Trump described America being in the middle of a medical war, and he has promised that he will provide the support that Americans need. One of the things that he hopes will bring some promise with it is a type of treatment that is used to tackle malaria. It's something called hydroxychloroquine, and here's how he announced it.
To me, that's even more important. The vaccine, by its nature, you have to have long tests because you have to make sure what goes into somebody's body is not going to do destruction, do bad things. So you need long tests. And they're doing great with the vaccines, but it's still a long process. But the therapies are something we can move on much faster, potentially. And the treatments that will be able to reduce the severity or duration of the symptoms, make people better.
So, because it's already out there, Donald Trump hopes that it means it doesn't present a lot of risk to those people that will be given it. It will be given through a prescription, and they say that will be made available. The FDA approved it very quickly. Just to give you an update on the number of cases, Dermot, that America is currently facing, there's been 82,000 tests. There are 10,201 people currently infected with coronavirus. New York State has recorded a big spike overnight in the number of cases there. That's at the epicenter of some of the outbreaks here in the United States. We learned from the press conference earlier on today that America is looking at around 10 counties in 3 states that really the focus of their concern at the moment. They also touched on young people yet again, because there is a lot of worry here that they are not taking heed of the government advice. And there, according to CDC statistics, are around 40% of hospitalized cases include those aged between 20 and 54 years old. Now, we also heard a lot of debate around medical supplies. There is a clear lack of PPE, protective clothing for health workers at the moment. Donald Trump and the Vice President Mike Pence said that they would be making 500 million masks eventually available, but they are not there yet. And the CDC is telling those that just can't get their hands on them to start using whatever material they can to make makeshift masks, Dermot.
Okay, Cordelia, many thanks, Cordelia Lynch there in Washington. And this is Sky News Tonight. Coming up, government plans to use mobile phone data to see if people really are social distancing.
Well, guys, I shall leave it there. I hope you all enjoyed the video. Give it a like, give it a comment, share it with your friends. I'll be back to do some more videos like this later, or do a stream on the PS4. You guys tell me what you think about this coronavirus. If it's silly or is it daft, or is it going to get worse, in your opinion or my opinion? Thank you for joining me. Give it a like, give it a comment, hit the notification bell. And I shall catch you guys in the next one. Keep safe. See you next one, guys. Peace.